Welcome to Module 6 in Dental Office Emergencies. This week we'll be covering acute pulmonary edema, heart failure, cardioconverters, and pacemakers. The readings of chapters 11 and 12 are required prior to taking the quiz bank questions for the week. Your topic for the 6th discussion posting will be presented at the end of this lecture.
Ongoing advances in the management of chronic heart failure, patient outcomes for acutely decompensated disease have not improved. Across Canada, patients hospitalized for heart failure continue to suffer frequent complications, and 16.5% die during their initial hospitalization. An examination of the pathophysiology of acute decompensated heart failure identifies promising new avenues for treatment. During heart failure, the heart cannot circulate enough blood at normal cardiac filling pressures to meet the metabolic needs of the brain, kidneys, heart, and other vital organs. The body responds by releasing neurohormones. Certain neurohormones help maintain blood pressure, but over time, they cause heart failure to worsen. One of these neurohormones is renin, released by the kidneys in response to decreased perfusion and increased sympathetic activity. Renin activates the renin-angiotensin-aldosterone system, or RAAS, by cleaving angiotensinogen in the liver to produce angiotensin-1, which is further converted to angiotensin-2 in the lungs. Angiotensin-2 binds to blood vessel walls, causing vasoconstriction. Angiotensin-2 also stimulates release of endothelin from endothelial cells. Angiotensin-2 and endothelin act on vascular smooth muscle, causing constriction of the coronary arteries and systemic arteries and veins. While vasoconstriction helps maintain blood pressure, it can also have maladaptive effects. For example, the weakened heart must pump harder against increased resistance in the systemic arteries, while constriction of the coronary arteries further compromises the myocardium's supply of oxygen. Venous constriction also contributes to displacement of fluid into the lungs and other tissues. Angiotensin-2 stimulates the adrenal glands to release aldosterone. Aldosterone causes the kidneys to reabsorb sodium into the bloodstream, and with it, water. Sodium and water retention cause a state of fluid overload that is exacerbated by venous constriction. Gaseous exchange in the lungs is inhibited by pulmonary edema. Buildup of fluid in and around the lungs increases the physical work of breathing. Patients with acute left-sided heart failure feel short of breath and fatigued. When right-sided heart failure occurs, fluid accumulates in the liver and legs. Apart from the activity of the RAAS, the body tries to maintain blood pressure using other mechanisms, such as releasing epinephrine from the adrenal glands and norepinephrine from sympathetic nerve endings. These catecholamines increase heart rate and contractility, in addition to causing arterial and venous constriction. Over time, chronic volume overload and the activity of angiotensin-2, aldosterone, and endothelin stimulate pathologic cardiac remodeling. The interstitial fibrosis and myocyte apoptosis associated with cardiac remodeling decrease heart wall elasticity, further inhibiting the heart's ability to relax and pump effectively. In summary, the neurohormonal response to heart failure causes vasoconstriction, fluid retention, and increased heart rate and contractility. In turn, these processes initiate a vicious cycle of further myocardial injury and escalating heart failure. Fortunately, additional neurohormonal responses modulate the activity of the RAAS, endothelin, epinephrine, and norepinephrine.
Alright, we're going to talk about pulmonary edema first, and then we'll talk about respiratory failure and acute respiratory distress syndrome, and that's it for this video. But, okay, so pulmonary edema, this is an emergency situation. You have to treat it rapidly once you recognize signs and symptoms of pulmonary edema. How this happens is whenever there's too much fluid in the blood volume for your body to be able to handle it, okay? So whenever you have too much blood volume pumped through the right side of the heart into the lungs, those capillaries can't handle that much fluid, and so it starts seeping into the alveoli, which then eventually basically you're going to end up drowning yourself from within because of the excess amount of blood volume. So you're going to start seeing some signs and symptoms like dyspnea, breathlessness, feelings of suffocation, cool, moist, cyanotic extremities, gray color to the skin, and a continuous cough. Usually you're going to see some blood-tinged frothy sputum. If they really feel like they're drowning in normal dry ground. It's very frightening. Here's your mnemonic device for pulmonary edema. This is how we treat it. We give them morphine, aminophylline, digitalis, diuretics, oxygen.
The heart is a 4-chambered pump with its own electrical system. When the electrical system is faulty or in need of repair, a cardiac device such as a pacemaker or defibrillator is implanted. A pacemaker keeps the heart from beating too slowly. When the heart's own electrical system misses a signal to stimulate the heart to beat, a pacemaker sends the signal to replace it. A defibrillator, or ICD, corrects fast heart rhythms from the ventricles or lower chambers of the heart. Most defibrillators have built-in pacemakers. A biventricular system is a pacemaker or defibrillator with 2 leads in the lower chambers or ventricles. This system helps the heart beat more efficiently and is often used to treat a condition called heart failure. Cardiac devices are small, lightweight electronic devices that hold a battery and tiny computer. Typically, they are placed under the skin just below the collarbone. Insulated wires or leads are threaded through large veins ending up in the heart. The leads are attached to the cardiac device. The batteries last an average of 5 to 7 years, depending on their use. Some last more than that, some last less. When a battery change is indicated, the entire device is replaced, but the leads or wires are often reused. Pacemakers, defibrillators, and heart monitoring devices are implanted in people of all ages. In most cases, individuals can lead a normal life with minimal restrictions. Strenuous exercise or sexual activity may be resumed once your physician clears you to do so. Common items that you may come in contact with, such as microwaves, computers, and metal detectors, will not interfere with the device's function. There are a few precautions. Cell phones need to stay 10 inches away from the implanted device due to potential interference. Close contact with running engines, generators, or welders should be avoided. Most medical procedures will not interfere with your implanted device, including X-rays, CAT scans, ultrasounds, and mammograms.
For the discussion posting this week, what precautions will you take with a patient that has a pacemaker? What recommendations will you offer your patient if they use an electric toothbrush and they have a pacemaker? Or what precautions will you take while using a Cavitron on a patient with a pacemaker? Post to the discussion board by Wednesday your initial response and respond to one of your peers posting by Sunday evening. This concludes your lecture for the week.